Hello! So it's been about a week since my last YouTube video, but since then we've received information from pathology about good old Ulga, and then also I've met with the oncologist in charge of radiography as well as the oncologist who will be in charge of my chemotherapy. As you can see, my hair is still kind of being a little funky now. You can still see where I have sutures that are still healing, but for the most part, my hair is allowed to be washed every day as long as I use like a baby shampoo, and I'm not too tight on the sutures because they are self-healing. So since my last video where I talked about my personal tumor that I have named Ulga, we have received the results from pathology, who actually said what it was. Now, before the actual surgery, we thought it was a benign tumor, and he said it was likely a class 2. Since it has been sent the report back from pathology, it is being called a glioblastoma IDH1, and it is WHO grade 4. So big difference. During the surgery, he was only able to remove 50%, whereas before, initially, we thought that he'd be able to get closer to like 80% of it out. And with the results of pathology, like I said, I've got radiographic treatment as well as chemotherapy that will be starting soon. They do have to make like a mask for my face, essentially so my face and head don't move when they shoot radiotherapy directly to Ulga here. That'll be about 6 weeks, and during that time I have, so just Monday through Friday is when I receive the treatments, and it's like literally just 15 to 20 minutes each time, and it goes directly to that spot. So it only goes to that spot. During that time, I will be on chemotherapy, specifically for a glioblastoma. And in addition to the chemotherapy, I will also take Zofran in case it makes me feel nauseous. And since the surgery, I've also been taking Keppra. If you're familiar with it, what I thought I was having as a side effect of the Ritalin/Concerta I took to study happened to be seizures. So I've actually been having what I refer to as myotonic seizures for about a year. They're less than a minute, and I have been started on a medication to get them to stop. But that medication itself does make my hands shake a little bit, just a little bit. But it's just one of those things that you learn. And so I've got the Keppra is new, but it's getting under control so that these little minor seizures where it's literally just my muscles, like I can talk through it and you could be looking at me and you can't even tell it's happening. So these last less than a minute, and with the Keppra getting under control because it is an everyday medication, those should be backing off before I even start the radio and chemotherapies. But so with knowing that it's a glioblastoma, I of course did what a medical student would do, and I pulled out my first aid. And if you have the 2017 like I do, you go to page 496, and it says a glioblastoma multiforme grade 4 astrocytoma is a common highly malignant primary brain tumor with about 1 year median survival, found in cerebral hemispheres, can cross corpus callosum and cause a butterfly glioma. So I have a nice little picture right here of the glioblastoma and the butterfly glioma. There's a better one in pathoma. If you're familiar with pathoma from good old Dr. Sitar, but you can see where the butterfly glioma actually goes across. And I actually, after my MRI, I rewatched the pathoma video of all the brain tumors, and I was like, oh, this is totally benign. But then when they actually did the therapy, they found the mutations that indicate is a glioblastoma. I do not, however, have a butterfly glioma where it's crossing hemispheres. Mine still is only in one hemisphere, and I've got a lot of treatment coming up, and I'll also be doing another video shortly to just kind of talk more about what a glioblastoma itself is. For the most part though, since I've had surgery, so tomorrow marks it will be week 3 since I had the operation. I've had no migraines, so I haven't had any head pain. I do sometimes where the sutures are, my temple here will vibrate, and you can actually see it kind of twitch a little bit. And they said that's totally natural. It happens. It's just a result of surgery. It doesn't hurt. It just kind of looks a little goofy. But overall, I've been doing a lot better. I do have these random little minor seizures, but within the next couple of days, we've got the Keppra set on a good dose, and they should stop on their own. And I've got an appointment to make the mask for my radiotherapy. And so once I actually get that started, it'll be like about a week or so that we actually start that. I'm excited to share what it's like. I know there are a lot of videos on here about glioblastoma, and some of them tell you one thing, some of you tell you another thing. Well, I hope to share what I can about what my glioblastoma is. That's all for now, and I hope to see you later. Bye!